Hey guys, and welcome back to my channel. My name is Maria Avi, and on this channel I do nursing vlogs, nursing tips and advice video, and I sometimes put up the occasional travel video. This week for my channel is a Student Nurse UK week, and as part of this series I've asked some of you guys to give me video suggestions and questions on topics that you'd like for me to cover over the next 7 days. And one of you guys has asked me to talk about my first nursing placement, so this is what this video is going to be about, as you can see from like the title as well. This video is going to be about my first nursing placement. So I've got to take my brain back to 3 years ago. I've written some notes because I don't want to miss out, you know, some like really important bits about the day for me. My first nursing placement was a respiratory ward. I remember like when it came out, because I know when I think back, like year one sometimes I was just kind of away with the wind, but when it actually came out, because at my university they basically publish it on like the VLE, which is like a forum type thing. That's the best way I can describe it. It's like a forum type thing, and they publish like reading lists, and they publish like assessment guidelines and assessment like timetable, learning outcomes and stuff on that. And they also published our practice placement location. So they basically had like, it was a Excel sheet, and it had like all your names from alphabetical order, and it also had right next to it where your placement was, the contacts, the person you should contact for your placement, not necessarily your mentor, the contact number, and just any other like relevant information. And basically when it was published, I remember like one of my housemates saying, "Oh my days, Maria, you're at a spiritual ward, you're at a spiritual ward." And I was like, what are you talking about? And she's like, "Oh, our first placement, the places have already been published." So I like, obviously I believed her, but you know, you just want to see for yourself. So I logged onto the VLE, which is like the nursing programs forum type thing, and I saw my name. I said my name on it, and then it said, you know, blah 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 hospital respiratory ward, and it said who I should contact. And at first I was kind of like, oh, respiratory ward, like, and people are like, oh my gosh, there's gonna be so much like people with phlegm. On my days I can't cope with phlegm. And I was like, no, I can deal with phlegm, I can deal with vomit, I can deal with, you know, all of that stuff. At the bottom of the spreadsheet it said not to contact your placement too early, because if you contact your placement too early, you risk like contacting them like 2-3 months in advance, and then you coming on to like your first day placement and they're completely forgetting who you are, because they have so many students, so many like other healthcare practitioners walking in and not walking in and out, but joining the ward team and leaving the ward team. So I think the university recommended, I believe they recommended contacting them between 2 and 6 weeks before you started. I contacted them 2 weeks before I started. So yeah, I believe it was a ward sister I spoke to, just said what my name was, you know, what year I was in. Obviously she already knew, but it's always good to like kind of re-clarify who you are, because sometimes you're not the only student on the ward. I know for my first placement there was also a third year, I didn't realise until I got there, but there was also a third year nursing student on the ward, which is quite reassuring for a first year to be like, okay, there's someone who's like, and even though she's in third year, there's someone who's like in a similar situation from me. And what some people do as well, they go to their placement beforehand. So say their placement's due to start on like the 1st of January, they might meet up like on like the 17th of December to meet their mentors and to see how the ward is like and all of that information. I didn't do that because I didn't feel the need to do it, and it isn't necessary. And I know some people who did do that and some people who didn't do that, and it really doesn't make a difference to your practice placement experience. But for my internship I did do that, because obviously I'm on my internship for 18 months. So I felt like it was in my best interest. My first placement, I believe it was 12 weeks long, and we had to complete 30 hours a week, and we were at uni roughly 1 day a week. Some people maybe 1 or 2 days a week, and then I was doing all the other stuff I was doing, you know, outside of that. So I went in on my first day of placement. The night before, I slept for like the whole entire night, but it wasn't good quality sleep. It was one of those sleeps where like you slept the whole entire night, but you still wake up kind of feeling tired. And I think it was more to do with just kind of being anxious and knowing that like this is like the next major step in like my nursing career and me actually becoming a nurse. So I went in with my little rucksack. Make sure you get a rucksack. Don't go, I see like too many nursing students like when they're going placement struggling with like a handbag or like a satchel thing. Get a rucksack so you can put your uniform in there, you can put all your equipment in there, you can put your boots in there, you can put a notepad. Just take a rucksack, it's so much more comfortable. Just take a rucksack, and get an Adios rucksack because they're really strong, and I've still got the same one. I don't use the same one, but I've still got the same one that I had when I first, you know, started placement. So I remember walking into the ward for the first time, and the first thing that stood out to me was the hospital smell. Like when I went on my first day of that placement, I'd never been in a hospital. I think I'd been in a hospital about maybe 3 times, and that was, you know, over 5 years ago. Like I'd never been I've never been on a proper ward in a proper hospital. So I know it's kind of ironic. So I walked in, met the ward sister. Everyone in the ward was really nice, except from occasional idiots. But she was really nice. She introduced me to who my mentor was. My mentor was super nice, and like, oh, I still, like, she's so nice. When I graduate, I'm gonna like write her a card. I'm actually gonna write all my mentors or kind of say thank you for, like, you know, being really good mentors, because I've been lucky enough to be blessed with like really good mentors. And so I met her, and then we basically had like a mini interview type thing, which for my uni you've got to do. It doesn't have to be the first day, but I'm sure that if you don't have an interview on your first day, like saying where your skills lie, blah, 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 you'll obviously have like a brief conversation as if it's the first time in your hospital. Have you worked as a healthcare assistant before? Have you got any healthcare experience? Are you a carer for anybody? And I was like, nope. Last time I was in hospital was like 5 years ago. I have no healthcare experience, no experience of actually being in hospital, but I knew this is what I wanted to do. So she said, based on, you know, what you've told me, I think it's probably best you get the fundamental bits of nursing down first. And those were things like observations, knowing what the normal parameters were, bedpans, more personal care. So I was working with the healthcare assistants for the first 2 weeks. Well, I was working really close with the healthcare assistants for the first 2 weeks. And if there was like anything interesting, if there was anything interesting or anything different happening in the ward out of the normal routine, my mentor would call me, or other nurses would call me and say, hey Maria, we're doing like not a tracheostomy, but oh Maria, we're doing this which we never really do. Do you want to like leave them for a minute and come join us? And the good thing about my first person, I felt like my mentor, she wasn't my only mentor. Like I felt like all the nurses on the wards, they were so helpful. Like they were so nice. I didn't feel like I just had one mentor, like one nurse I could just go to for advice, or one nurse who would take me under her wing. Like literally all the nurses took me under my wing. So, you know, some days when I'd go in and my mentor wasn't in, it wasn't a problem for me, because I knew like all the other nurses were there to support me. So yeah, that's how my first day was. I'm gonna be honest, for my first day I wasn't really nervous. I was a bit like anxious, as in, oh my gosh, like this is actually really happening. Like I cannot believe that I remember like being in secondary school, like applying for UCAS to get a place on this degree, and now I'm actually on it. It wasn't really a nervousness. And I will say that I think most students are nervous, and most of my friends who were on the nursing degree, they were nervous. But I just think I'm a bit different, kind of. No, not a bit different, but I don't really get nervous. I might get a bit anxious, but then that kind of dies away. And I think the whole reason behind that is because I was like, I can't really control the day. Like I can control how positive or negative it is, but I can't. There's certain things you can't control, and I'm all about being intentional and, you know, pushing for everything, or pushing, you know, just being intentional about what you do and what you don't do. But sometimes you've just got to kind of sit down and, you know, kind of just go with the wind. Not really go with the flow type thing, because only dead fish go with the flow, but kind of just sit there and deal with things as they happen, rather than trying to preempt it. So one tip I say, don't preempt anything, because you're just going to get yourself like super nervous. Just go in there with like an open mind. And my first placement as well, I should have said this earlier, my first placement, because I started my course like mid-September time, the first placement I believe started after Christmas. So I think it was like January the 4th or something, was like the first official day when we could start placement. So obviously from like September right up until Christmas, we were obviously in theory like full-time, 5 days a week. And we were learning things like, you know, basic nursing skills, personal skills, like bedpans and personal hygiene and the importance of all of that. I think we learned briefly about, you know, injections like subcut and muscular injections and how to administer those correctly. We learned briefly about what was I going to say? We learned briefly about like the vital signs like temperature, blood pressure, heart rate, what the normal parameters are, and what it means if it's lower or higher than what it usually is. When to like escalate, you know, care to the nurse or nurse in charge, or maybe even the doctor and stuff like that. And a lot of it was basic. And I remember thinking, oh my gosh, like I'm not even gonna lie, I remember thinking like before I started my placement, I already know these skills. Like, come on, this is like, if I'm honest, it kind of felt like GCSE A-level stuff. But I feel like if being a nurse or working in healthcare is something you aspire to, you might think, oh my gosh, I already know this stuff. But tell me, you know it, but until you actually have to apply it in theory, it's two completely different things. Like I remember like walking in and one of the healthcare assistants saying, oh, can you help me, like, you know, put a patient on the bedpan? I'm thinking, I do know how to do it. I've been taught it in theory. We've practiced it on each other. Do you know what I mean? Like, I know exactly how to do it, but until you actually have to apply it in theory. So I will say that, you know, the preparation that you will do before you start your nursing placement, don't think, oh my gosh, I already know this. We all know you already know that. Most people already know, you know, what the normal blood pressure levels are or what the normal body temperature is, but you need to apply it, like, That's why if your university or whoever you're doing your degree with has got like a CSU, like a clinical simulation unit, make sure you attend all those sessions, because at the time it can seem a bit tedious, but when you're on your first day placement, you are literally drawing every bit of memory you can remember from those sessions. So yeah, definitely make sure you go to it. I'd say my first placement was like a really positive experience. I did spend a lot of time with the healthcare assistants, but that's because I literally had no healthcare experience. Like, the theoretical side for me of nursing was a lot more stronger than the practical side. The practical side, I had no experience. So make sure when you start your first placement, within like the first week or within the first 2 weeks, you have a proper, 10, 20, 50, however long it takes minutes, sit down with your mentor to talk about where you are and set goals for yourself. Because I can imagine if I'd, worked as a healthcare assistant before, or if I was like a nurse in a different country before with like years of experience, I probably wouldn't have had to have worked with the healthcare assistants so closely. And if you do have to work with the healthcare assistants, don't see it as a bad thing, because some of them have a wealth of experience. Don't like look down on healthcare assistants thinking, oh, they're just healthcare assistants, what do they know? Trust me, there are some healthcare assistants, in my opinion, don't shoot me for it, in my opinion, who are more qualified than some of the nurses I've come across. So now I'm going to start with some of the tips and advice that I can give to first year nursing students who will be starting their first nursing placement. So the first tip I would give to you guys is, if you have a co-mentor, make sure you utilise your co-mentor and don't see them as secondary to your main mentor. Like, your co-mentor and your main mentor are probably just as good as each other. And the reason why I say work with both of them is because sometimes your co-mentor might have a different skill set than what your main mentor has, and sometimes your main mentor obviously will have a different skill set than your co-mentor. It doesn't mean to say that one mentor is worse or better than the other, but obviously, as with everything in life, people have different skills, so make sure you work with a mixture of the two. The second tip I would give to you guys is utilize spoke experiences. On my first placement, I did so many different spoke experiences. It was like, the spoke experiences I did in my first placement were actually amazing. Understand that just because you're an adult nurse doesn't necessarily mean that your first placement will be on an adult based placement. Just like if you're a mental health nurse, or if you're a child nurse, or if you're a learning disability nurse, doesn't necessarily mean that you're going to get a placement that is closely aligned with that. I know one of the other girls in my CLG group, which is basically like the nursing cohort, they split us into smaller groups just to make us easier to manage. She was a mental health nurse, and her first placement was on I can't remember what type of ward or department it was, but it wasn't mental health based, it was adult health based. So if you are an adult nursing student and you're put on like a mental health and you're put in a mental health hospital, don't fret. Like, do not fret, do not worry, because think about it, whether you are mental health or whether you are child or learning disability or adult, you're all starting off at the same point. There is a lot to be learned from every single different branch of nursing. So don't think, oh, I do adult nursing, therefore I don't need to worry about mental health. Mental health, learning disability, child nursing, it covers every area of nursing. Yes, they are separate categories, but they're all intertwined. For example, you might have a patient who has COPD, but because of that COPD, they also have anxiety. Do you know what I mean? Like, they're all linked together. So don't be upset, don't be annoyed, don't be nervous if your first placement isn't an adult health placement. So that is the end of the video. I really hope that it was informative and entertaining for you. If it was, then make sure you give it a thumbs up. And if you're not already subscribed to my YouTube channel, make sure you subscribe so you don't miss any of my uploads. And if you want more information, make sure you go back onto my channel, click on my nursing playlist, and I've got like a whole host of videos which will give you, some more information about, the nursing degree study in the UK. In tomorrow's video, as part of my student nurse UK week, I'm going to be talking about the modules that I studied for first year. So if you're interested in that, make sure you tune back in at 7:30. If you're already subscribed, you'll get a notification, and make sure you turn your notifications so you're informed of every video that I post, and then you can obviously watch them. Make sure as well that you share these videos with your friends and family. If you're already on your nursing degree, why not share it with your cohorts? If you're starting your nursing degree this week, next week, or over the next couple of weeks or months, it could be like a topic of conversation for you and your housemates, and you can sit down together and watch it as a group. I don't know, but just make sure you like, comment and subscribe. Thank you guys so much for watching, and like I said, I really hope that these videos are informative for you, because I know how it's like being a student nurse and having so many questions but not knowing who to ask or where to ask. So I'm hoping that I'm like kind of filling that void in. And if you have any more video suggestions, make sure you put it in the comment section below, and I will really take into consideration. This video topic was based on, you know, a suggestion someone made, and me sharing my first year modules with you tomorrow was also based on a suggestion. So if you have any more suggestions, it's fine, put in the comments box below, and I will see you guys in tomorrow's video. Bye.